Hi, my name is Juliet, and I'm the creator and host of Connecting the Dots podcast. I love ideas and problem solving, and my career in communications has led me down a path of curiosity. Why we do what we do, how we tell better stories, and how African scientists solve everyday problems. Join me on this enlightening and entertaining exploration of African science like you've never experienced before. Get ready to laugh, learn, and be inspired. So today, I have the pleasure of being joined by Justus Ogando, who is a seasoned global health, market access, and climate change expert with over 2.5 decades of experience driving impactful transformation across Africa. Justus Ogando is a founder and executive director of Spectrum Health Climate Initiative. Spectrum is an independent nonprofit organization based in Kenya, working across Africa to tackle the challenges at the intersection of climate change, health, and other areas affected by the climate crisis. His goal and his team's goal is to find practical, nature-friendly, and health-focused solutions that build on existing efforts to protect the planet. By uncovering hidden connections and breaking down complex climate problems, he brings together different sectors to create stronger, more effective initiatives that make a real difference in addressing these urgent issues. Justice, karibu sana to Connecting the Dots podcast.
Thank you, Juliet, for having me.
It's a pleasure to host you today. And one of the things we want to be able to discuss together is about the intersectionality of climate, health, agriculture, and biodiversity. What are some surprising or lesser known sectors that contribute to climate change, for example?
Thank you, Juliet. I think when you look at the issue of climate and define it in terms of a climate crisis as a health crisis, you'll be able to see touch points with other sectors in terms of how they're actually contributing to our health challenges. For instance, energy sector. That is one that if we can't guarantee our population's security of energy, reliable energy supply, they will naturally default to unsafe fuels. They will go to biomass, cow dung usage, and all that. And this then lead to extenuating factors on their health, like indoor pollution.
Right.
You find we have disability-adjusted challenges with our population health in terms of people having respiratory problems, they're having non-communicable diseases are increasing. So energy security has a touch point on health. Environment as well, and agriculture as well. Our food needs to offer us the nutrition we need. However, sometimes we find we have applied excess fertilizers in our crops. And what we are getting is not even nutritious sometimes. We are dealing with illnesses, gastroinfections stemming from chemical overuse. That is also degrading our soils and running off our soil nutrients. Remember, these synthetic fertilizers are also greenhouse gas emitters. So it's a double tragedy. So we look at health, a climate crisis as a health crisis, and that is the lens through which we say address climate change through the health-centric lens. Thank you.
And how do these sectors indirectly impact public health outcomes? I know you've talked about indoor pollution and the rise of NCDs, non-communicable diseases. Mm-hmm. Can you just say a bit more about that?
How they influence?
Yeah, so how the sectors of, say, use of fossil fuels, because the energy that we're saying people should stop using.
Unsafe fuels.
Yeah. Yes. Uh-huh. So indoor pollution, for example, public health outcomes are being impacted.
Yes.
But how? Just unpack that a little bit.
Okay. We need to bring in the element of economic factors. Mm-hmm. Households are pressed economically in terms of their budgets, the burden of the things they need to take care of. And sometimes if you offer a solution, you have to be alive to the realities on the ground. Are people able to afford the grid connection for, say, Kenya Power? No. So what option are you giving them?
Solar.
How do you tell a Maasai woman, stop using cow dung?
Yeah.
And they're not connected to the last mile grid.
Right.
The cheaper option the government has been rolling out because they're not in gainful employment. So you have to work around that mechanism with their challenges to contextualize and develop for them solutions that meet their needs. There's a mantra I always say, if you develop a solution for me without me, it is against me. So if I bring you an LPG gas, you can't refill it as a Maasai woman. Yeah. But if I look for biochar solutions that don't emit, but they look like charcoal, then you're having a bio-friendly fuel.
Yeah.
So how do we work with what you have to develop for you solutions that meet your needs where you are? And I think that is the angle through which we need to look at the interventions, work with the communities and those who are impacted to ensure you deliver to them solutions that address their circumstances, unique circumstances.
I mean, you've given the example of the Maasai woman,
Yeah.
And creating solutions that do not involve them. And I'm just remembering the production team and I were discussing recently that, African governments, when they went to the international meetings for climate or the climate conferences, were complaining that, for low middle income countries, they are under pressure to begin to use green energy, for example. And, one of the presidents, I can't remember, it was one of the Central African, maybe Central African countries, was complaining that the West is pushing down, mitigation strategies that might not be good for this part of the world. And I wonder, what's your take on that?
I actually agree with the fact that Africa has contributed relatively less to the greenhouse emission profile at 4%. We are the least contributors. The industrialized world contributes a lot more. But we can't hang on to that fact that because we contribute less, our response should be less.
Yeah.
No, we can't. We are bearing heavy impact on our infrastructures and system. We are vulnerable and exposed, and we are not well endowed financially to deal with these climate effects. So we need to really make solutions that work for us. There are areas where I've discovered that some of the global pronouncements might have been formulated with the noble ideas in mind.
Mm-hmm.
But when they are brought to Africa for implementation, people don't relate. So when you tell the African population and governments net zero, they just don't know how to achieve that when they are trying to also catch up in industrialization to improve the economic circumstances. And remember, economic growth is in tandem with energy use and expansion.
Right, because you need energy to
develop. Need energy to grow your industries, yeah. So where is the trade-off? That is always a catch. Where is the trade-off between I want to achieve economic growth, but in a less emissive way? Which are the safer options? And this is the trade-off we need to discuss. And then when you come to community level, people want things they can relate with. You can't tell a community person in Garissa or one of the ASOL counties that we need to work towards net zero target when the floods that washed off their crops has left them food deficient. All they want to know is where will I get my next food?
Meal. Yeah.
Not how do I achieve net zero target. So these are the dynamics around psychological blindness that Spectrum is also trying to address as we translate national policy into the sub-national level, at county level, and downstream to community. How do we make these taxonomies and language and intervention relatable? At some point, we've had a discussion with colleagues in terms of, do we even want to do language translation for climate literacy? Because it has not been done.
Yeah.
So if I'm talking to a Maasai and I'm addressing their issues, I'm talking to them in their language, in a way they can relate with it. If we are talking about they use the roots of acacia tree as medicinal for gastro infections.
Okay.
Because they can't afford the cost of care. So the trade-offs. So how do I talk to them about biodiversity? Since this is their livelihood, this is how they live their lives.
Yeah.
This traditional medicine has worked for them. I just can't come and tell them, because of net zero targets, let's stop cutting down the trees. Let us now go to hospital. Where will the money come from for buying the medicines and all that? So so it's a trade-off. Everything here is a trade-off, and we have to determine to work with communities in achieving solutions that meet their needs, but also help us meet our national targets. But having said that, I think we have to be alive to the fact that all governments that have signed into the global treaties are bound by them. So we try to manage all these dynamics to ensure that we are working towards a common goal.
So, African governments such as ours here in Kenya and across the continent are really trying to mitigate the climate crisis. What are some of the gaps that they haven't filled yet?
Yeah. One of the biggest gaps is when it comes to particularly climate change and health nexus financing. Not adequate resources are available to meet the ambitious goals that have been set up. The other bit is in the area of policy making. We find, not unique to Kenya, but most countries, research and policy are still not working in tandem.
Right.
Scientists are doing their work.
Yeah.
Policymakers are making their policy decisions. But climate requires a transdisciplinary approach. Let science inform policy and policy narrative inform action.
Yeah.
And that is where Spectrum defines our dot connecting.
Yes.
We are dot connecting across science, industry, markets, policy, government, civil society, so that whatever intervention comes through, it has the buy-in of everyone.
Yeah.
And we have considered all the risk factors and all the quick wins that we can harness. So at this point, I see a lot of work has been done in science, but the industry is running its own show. The private sector players are running their own show with a limited intervention of science in defining their work. So when you come to product developers, like for beverage manufacturers, they use plastics.
Yes.
But nobody has told them about the impact of microplastics on our anatomy.
But surely, I mean, even before you talk about the anatomy, even just the environment, the amount of water bottles on the streets, you know.
Yeah.
So I find it very interesting when you say industry and beverage, you know, and I wonder, aren't they doing any form of market analysis, you know, and it does not have to be profit making. It can also be from is it a ESG perspective?
Yeah. Interesting question. So I want to demystify something. It's like they're doing something, yes, but they are not well guided.
Okay.
Science needs to guide action.
Yeah.
So for instance, they are intervening at the point of the UN agency is strong on let us limit plastic usage.
Yeah.
Because of the environment. But we need to also look at it from a health perspective so that it can drive the consumer behavior. Do I buy water in the plastic or do I walk with my bottle and dispense, refill and all that? Those are the things we're talking about. Because, you know, producers produce because of customer preference. So this is a connected thing.
Yeah.
If I don't work on the consumer preference and behavior, whatever I'm doing with the industry will not achieve much because they are producing what the consumer is buying. They want dispensables with a squeeze, you know,
conferences
iced tea,
with water bottles.
Yeah, the convenience. I'm trendy, so I need this plastic thing.
Yeah.
So there's a whole dynamics that marketing teams need to work with. The product developers as well. When they're developing the products, they have to think through the implications on our health. So if I'm designing a packaging using polymer base, like the petroleum polymer base.
Yeah. When you say polymer,
these are the derivatives from the petroleum used to manufacture plastics. Yeah, because we have different types of polymer. There is the polystyrene, which is for the foam. The electronics are packaged in bubble wraps and the white foam thing.
Yeah.
And then there's polyethylene, which was banned.
Okay, yes.
And then we have the polypropylene. So these are all from petroleum.
We like to thank our Minister of Environment then.
Professor Judy Wakungu.
Yes.
Yeah, she did a good job.
She did an amazing job.
But we haven't stopped the region, which is a source of influx of more of this polythene.
You can't do one thing by yourself.
So climate needs an ecosystem approach. Yeah, so countries need to cooperate. And so when you look at that, the element of the product designers thinking through this, the end game, think through the impact it will have on the population and work backwards and now look at your value chain.
Yeah.
This is the difference between value chain and supply chain. Value chain looks at how you add value to a workflow, to a process, a production process. So do I design biodegradable bottles? And will the people buy them?
Yeah.
People who are selling coffee, they have the paper cups.
Yes.
There's a reason there are reasons they went that direction because they're caring for the environment. But they also need to know about the covering,
which is plastic.
Care for the people's health.
Yeah. Sorry, styrofoam is not the same as paper cups, right?
No,
those are two different.
Yeah, they're two different. Okay. Yeah. So I think this for me is the biggest issue, that you have to look at the lenses of health, environment, nature positive, and health-centric to be able to drive a proper agenda even with our markets.
Yeah.
Because you can't tell them face off. What will they be using if you tell them to face off? Whatever. Okay. If you tell people to stop fossil fuel use, which option are you giving them? So you have to keep on weighing the trade-off as you continue negotiating policies that are progressive.
So it's interesting, we've touched a little bit on industry, and I guess this is where the dot connecting by Spectrum comes in. Industry being one, and then governments and regulations and policy. And you've talked about the science being on one corner of the room and the governments being on the other corner, which is weird because at the end of the day, the consumer, the individual or the citizen is really going to the healthcare providers for health. They're looking at agriculture, whether it's in terms of food and food consumption and nutrition. We're also looking at biodiversity in terms of energy, like you've talked about. And with the Maasai people, looking at the traditional medicines. I'm wondering from a policy perspective, what is it that scientists are not doing well to reach out to the policymakers and the policymakers also to go and say which professor, doctor is doing research in this area, and what can you tell us in terms of this policy that we are crafting as politicians?
Okay.
And is there goodwill?
Thank you. Yes, that's a good question. So where Spectrum comes in that's the gap we saw in the market. We saw that science is doing its work, very noble work. They're getting all the funding, but it's mostly staying in the research. It's published. There's all this excitement about publishing the work.
Yeah.
But then there's limited capacity and ability to translate that research into a bankable and investable venture.
Oh, I like that.
That is why Spectrum came in as a social enterprise.
Okay.
Look at what the scientists are doing and look at the business opportunities people can work with for resilience. And then we translate that. That's why we talked about analytical rigor. You've seen the insight, influence, impact thing. Yeah. So we are just moving science from paper, the data, and we are translating it to a bankable and investable venture and building the narrative for policy from there, as well as the narrative for investment.
Yeah.
Then help partners, bring partners on board. We write proposals for fundraising.
Yeah.
Because the biggest challenge is just how do you define a scientific research as a venture that you can bank on? Because when you're talking to private sector, the main challenge is profit.
Yeah. Businesses
were modeled mostly for profit and less consciously for sustainability. So you can't convince a shareholder. And otherwise, you have to just tell them, this is how we will grow commerce. Yeah. So climate is a commerce thing.
Okay. Explain that.
You must have a money value to the whole process.
Oh my goodness.
Yes, because we got here because of economic business and our maladaptive actions.
Yes.
Yeah. The way the world is set up is there are natural emissions, like the volcanic eruptions. But then there's this other layer, which man-made. Is man-made. They call it anthropogenic, man-made emission. That is the biggest challenge to greenhouse gases. And it's all industrialization and extraction. And we need to change the whole thinking around how we do business from being destructive and overexploitative on production to being regenerative. And that is the concept of circular economy I was talking about.
Okay.
The circular economy is how do we do business in a way in which we are replenishing the world and not causing health harms, healthcare harm to the population. Yeah, and that is the entry of planetary health.
Yeah.
How do we do business with a conscience? How do we do business in a way in which we can replenish this earth as we extract from it? Because for me, the biggest thing is this a world I want to hand over to a future generation to inherit something they did not cause
contribute
to damaging?
Right.
And that's the wake-up call we need to have. Everything I do, I have to use that lens, sense check. Like, what world will I be living with the people coming after me?
So let's touch a little bit on the bankable solutions. What innovative solutions have you been able to come up with? I know there was one on the supply chain.
Yes.
And I wonder if you want to touch a little bit on that.
Yeah. So for the supply chain, this was a very, very, very rudimentary experience. I was just cycling. I like cycling. I was cycling and the ideas were coming to me. And one of them was like, on health side, we were struggling with treatment access.
Okay.
People don't get medicines. I was largely on the HIV program with the Clinton Health Access, and people were not getting medicines at the last mile.
Yeah.
But the donors are bringing the medicines in the country. And I was asking, where's the disconnect? So we are getting in the urban centers, they would get, but in the rural areas, they would say, oh, we were told the delivery has not been done. We may need to check on such and such a day. So I tried mapping this chain, the supply chain backwards. And I noticed unique circumstances across 20 countries in Africa. Medicines were expiring in the central medical stores.
Oh, wow.
And it got my interest.
Why?
And I started asking, how do we find medicines expiring when people are lacking them? And in my analysis, I found there are dynamics that were coming up. One, the biggest procurement mechanism schemes or funding schemes have their own different timelines.
Mm-hmm.
And there is limited synchronicity.
Yeah.
So if one is delaying because of signing of cooperative agreements and MOUs, the buyer will go and approach another partner to plug in with an emergency stock.
Yeah, because patients are still requiring treatment.
Especially lifelong treatment.
Yeah.
But this original scheme will still deliver the same quantity. So you have entropic accumulation of stocks and wastage. The other bit was in the area of when guidelines change, it takes forever. And sometimes you find the buyers are buying old medicines that are being phased out. New ones are coming up. The pipeline is clogged. So this was then causing a lot of challenges. And I decided to embark on a process of engaging countries, working with a number of parties to talk to PSS on email, to just engage them and have them to know that we have stocks which will expire in your hands. If you are not able to utilize them before the expiry, there's another country that is stocked out. And this exercise started in Lesotho.
Okay.
And it worked between Lesotho and Eswatini.
Yeah.
And we were able to save close to $40,000 worth of medicines that was going to expire, but was needed in Eswatini.
Okay.
Then we tested the same, and Uganda came through with excess stocks for TB treatment, and we were able to move it to Nigeria. And in this case, no single shilling was spent from my pocket. It was just countries engaging, and the terms were clear. Recipient takes over the cost of shipping it. So the trade-off was, does it make sense for you to place emergency order to India?
Yeah.
Or can you take it from Africa?
Next door.
And for me, that was a window for inter-Africa trade and also helping to build an African health sovereignty where we take care of our health in a way in which we can trade within ourselves, circulate medicines within ourselves. And the many questions I was asking was, are these medicines not approved by the same stringent regulatory authority? Yes. Are they not bought from more or less the same manufacturer? Yes. Don't we have the same paperwork, certification, approval, and all that across? Yes. So then, why can't we look at how pandemics don't obey borders?
Yeah.
Climate effects don't obey borders, and allow these commodities to also not obey borders.
Yeah.
By going out to help people. So that's how we ended up achieving a success with this process. It's called CBEST, Cross-Border Excess Stocks Transfer, which is a virtual Africa Stock Exchange, if you may call it. We were able to save $1.5 million. We were able to achieve healthcare without harm.
Yeah.
Those are products that would have expired and gotten burnt. And we also averted emission of greenhouse gases from burning the plastics that carry the medicines. And we were also able to give patients in stocked out countries about 20,000 patient doses through this exercise.
So I want to ask you a naive question when it comes to supply chain. If you think about, let's go back to the beverage industry.
Yes.
Coca-Cola. You know, makes like Coca-Cola in the community.
Yeah.
How is it possible that private sector like Coca-Cola company, for example, can reach the last mile, and yet when it comes to healthcare, we struggle with the same framework? It's the same person being reached. It's just from one, it's on entertainment or refreshment perspective. On the other, it's on a healthcare. And you'd think the healthcare one would be prioritized when it comes to supply chain.
Coming from private sector and getting into development sector, especially global health, my first question, and I told you I was challenged. I didn't know whether this is what I want to do for life. I can tell you some of the principles we have in public sector may not keep your job in private sector. Yeah, you can't afford waste.
Yeah.
You can't.
In private sector.
In private sector, that will be your salary gone, your bonus, But in public sector, it seems to be normalized. So because we're always buffering against an unforeseen emergency, a pandemic, we just buffer. But then if it's not used, we ban because we know a donor funding will come. So I think
wastage.
so there's that normal wastage. I call it the entropic accumulation of waste in the system that has been accepted.
Yeah.
Just we need to have stocks that we need to make room for normal loss. Just like in construction, when you're done for bill of materials, you'll be told for this total budget, put 10% for loss, wastage, fundis will steal from you. You know, so in health, it seems to be the norm. And I think for me, the catch is I came with a mindset, I cannot afford waste.
Mm-hmm.
Part of my life, I grew up in the slums, and I know what it means to lack. So when I see waste, it affects me.
Yeah.
And so when I saw medicines at central level being wasted, I would always want to connect the chain. And supply chain is a people chain. People must be coordinated in a way in which they can deliver the value.
Like that.
Yeah.
Yeah.
Coca-Cola is achieving that because it has organized its internal levers to deliver that value at the end. And Coca-Cola is not just about the drink. Their strategic fit is around share of the throat, because your throat, people are competing for it. Tea manufacturer, coffee. So we want a share of your throat.
Yeah.
But for medicines, we have never thought about a share of the throat for those that we take orally, you know. So I think medicine is just a case of more like benevolence, but the business mindset of running that supply chain is one that I've seen is a bit lacking. And for me, I've been trying to infuse that in the supply chain, that we need to have value attached to what we do. We have to think through why we do what we do. So that if you're delivering medicines to people to save lives, always remember, if somebody doesn't get it, they'll die. So do whatever it takes to get this medicine.
To make sure that they receive it.
Limit wastage. Let us address treatment access differently. It's not that a patient in the last mile cannot access the medicine. It's just ensuring that what you got and you promised to deliver must get to that patient in the right quantity, right time, right place, so that they can take it. Yeah.
It sounds to me the example you have given of, with private sector and industry, that they cannot afford any wastage. It sounds like in the scientific sector, in government, they need to almost apply the same principles, right? And then the one thing, I don't want to mention any countries in the world at the moment that is beginning to test that in practice. But, from your mention of your growing up, I wonder if you want to briefly talk about Spectrum and how Spectrum came to be, and just a bit about your background. Who are you? Where did you come from? What's your background, professional and personal?
Okay, thank you. And I was expecting that question. So I have a curious mind, and I tend to go for things that have an edge. So there's a personality trait to that. And I think when I took my accounting course, I realized I was not cut out for accounting. And I just accepted to do it. The euphoria at the time was CPA, and then I went to do BCom, and that was it. So along the way, I discovered my mindset is cut out for a different pathway in life. And I'm the kind of person who will take something that is complete, throw it off balance, so that I can see if there are 10 ways or more to assemble it back. Like I like testing things like that. And that is a curious pathway. And that curiosity is akin to water finding its level or a river defining its course. And for me, learning has just been that pathway of discovery. I find something, it intrigues me. I want to do more research on it. Not academic research, personal research. I want to understand it my way. So that I can relate with it. And this is what has led me along the way to start the initiatives like the intercountry stock transfer. Because coming from private sector, I was looking at it like, why would somebody in another country die for lack of ARVs when the next door country is banning the same ARVs? Aren't we Africans? Aren't we the same? Are we not humans? And for me, that concept of bringing a dignity-affirming lifestyle drives me deeply. It fuels my passion. Every engagement in climate change is defined by the need to deliver dignity-affirming amenities to the vulnerable population. And so Spectrum was born out of that. How do we deliver health without causing harm, but still giving people a dignity-affirming lifestyle? Because we cannot continue talking of the problems that were mentioned in 1982 or 81 today. Like things must have changed. Our forefathers didn't have the kind of medical facility infrastructures we enjoy today. They were living off the plants and the bushes and all that,
Mhm.
you know. We have better facilities than them, but we have more complex diseases, more complex challenges in our health system. So we need to address that maladaptation in the process. And this is where we are coming in to look at areas like circular economy. Can it help us address our psychological blindness around emissions? Because we are wasting things. Food waste is there, medical waste, and we are burning them and we are emitting again, and people are sniffing. So it's a whole chain. And if you think through it, when Spectrum was founded, what we were addressing is negligence, ignorance, and neglect.
Yeah.
Climate issue has a large part, of climate issue is largely on people are negligent, ignorance, and neglectful. But the resulting effect, we are reaping it in chaos, devastation, and loss of life. So let me give you a case in point. 80% of the world's energy is actually from oil fuels, fossil fuels. 26% from coal. 68% of household energy is from polluting sources, biomass, cow dung, all these kind of things.
Yeah. Wow,
the
that's
world.
high.
So that predisposes 100 million people to unsafe fuel sources. I schooled with that stuff they called koroboi, the paraffin lamp, the wick, and I sniffed that my entire life, you know, but I did not care about my health. So these are the things we're saying, that there's all the connectedness that we need to address through the health-centric lens, and we need to come to a point where we are questioning some of the decisions we make. We are here in the climate issue largely because we pursued convenience and profit at all costs.
Yeah.
And now we need to question our morals as well. We need to bring back the virtues of how was this world designed?
Yeah.
And are we handling it the best way we can, or we are causing more damage?
Yeah. Interesting. Are there any common myths or misconceptions about the intersection of global health and climate that you think need to be addressed to drive more effective action?
Yeah, and I think one of those is majority of the population are still not connected with the reality that climate change is an issue.
Yeah.
Yeah. It's even the most educated still have that challenge.
This is a problem, actually.
Yes. Yeah, so if we don't hone the intuition around climate literacy, people are not relating. They do not see the overtime effect of this phenomenon as it happens. You see an area like Southeast Asia, the Andaman Sea, it tends to have lots of repetitive cyclones and hurricanes, you know, which precipitate from the ocean.
Yeah.
So when the warm waters vaporize and all that, then they start building up. And it causes a huge challenge on the landmass. Like Bangladesh is literally below sea level. So it's purely mushy ocean layer. So this kind of things, scientists are able to project them through the IPCC and UNFCCC framework. They always showcase evidence of what is happening and the patterns in the world.
Yeah.
So we also need to look at our own situation. Our small counties are victims of repeated cycles of drought and flooding. And this then has washed off our soil nutrients. This has washed off our lands. And so people are food insecure. And we have to do other things to optimize this soil to give us the foods we want, but we are not sure we are doing it the right way. So I think it's all connected in a chain, that one of the things that would help is let us have climate literacy, build capacity, get people to understand climate in a way they can relate with. And then two, let us have progressive policies that can be implementable. I know we have adapted global policies, but we need to contextualize some of the aspects as we work with communities to be able to relate with the issues they are facing. Priorities for Budalangi and Nyakach are different from the priorities of Mombasa.
On the coast.
Maybe, yeah, you know. So we have to work within that context.
You know, you made it very technical when you said dot connecting across research, policy, markets, industry, but it sounds that with the myths and misconception, maybe we need to dot connect even with the community. That example you've given about droughts, flooding, and the impact on agriculture, soil erosion, and then you can't grow quality, nutrient-rich foods. And then subsequently, you're developing health problems because you're not having the nutrients, you know, that go into your body. I wonder, as we wrap up, you know, connect the dots for us. You take a step back, you look at the world before you. What scares, what fascinates you?
What scares me is also similar to what fascinates me.
Okay.
Yeah.
And it doesn't have to be in the nexus of climate, health, agriculture.
No. It's more like a superpower, a weird superpower. If I had that superpower,
Yeah.
I would wish to reconstruct this world.
Okay, interesting.
The way it was given to us.
Say more.
The world was made in an equilibrium kind of way. It had its own mechanism for replenishing itself, regenerating itself, then entered humans. We have come with excess force, but we have not created mechanisms for attenuating what we are, our maladaptation. Yeah, so it's all around. It was working before we became industrialized. It was working in a certain way. But does civilization mean we are regressing? That's one of the things I struggled with, because I get worried when we want to advance too fast, and then it becomes our Achilles heel. Mm-hmm. We are suffering from that advancement. And Nairobi is a concrete jungle.
Yeah. Oh my gosh.
You should look at the air quality parameters for Nairobi. And you ask yourself, why does everyone want to be in Nairobi? Why isn't the government growing other towns so that we can spread out the risk profile? And you have to question the incentives that are created for investors and investments, mm-hmm. so that they can now see the gaps that are creating the situation we have. Because building this city is like a negotiation. You want to expand the road, you have to negotiate with the owners of like people own the country differently. So you have to buy land from here, do this to construct a road.
Yeah.
But you miss the drainage, or you cross the pipelines of clean water and they mix with the dirty water. And so there's a whole lot of ecosystem planning that is difficult to achieve where the systems have been constructed organically. Kajiado next door is suffering from the same.
Yeah.
Planning is becoming tough, that they decided recently they want to control development.
In Kajiado?
Yeah.
Neighboring Nairobi.
These things have put pressure on the growth of a community, a city, amenities, and all that. So it's good to always have that blank slate to think. That's why I'm saying if I had a superpower, I would wish to go back to that blank blueprint that was created for the world, so that we can see, how do we build better?
Yeah.
How do we build with the consciousness that this will be for a future generation? It will grow this way. They'll have these needs. We plan. I know there are counties where the policy is the distance between facilities should be 15 kilometers or 10 kilometers.
Oh.
But I'm not sure that is observed. So people are seeking healthcare, but they have to cover a long commute.
Distance to go.
Yeah. So there are many extenuating factors that need to be considered.
Okay. I mean, it's interesting. I always wonder if there are more schools than there are hospitals in this country.
And churches.
and churches. Sometimes we need to be more spiritual and religious, and we need to look after our health. As you wrap up and your call to action, mm-hmm. I wonder if you are hopeful about the future, and the world as it is, and we're living for the next generation.
Yeah, sure. I'm an optimist, and sometimes I have to regulate my optimism, because there are those who are pessimists. They like checking themselves, mm-hmm. to avoid the embarrassment of it all. And I'm like, well, it's the world we have. The moment you realize that there is no planet B,
Mars, Elon Musk.
Who is going there?
Elon
will it transport all the 8 billion people? I don't know. So this is the planet we have.
Yeah.
So how do we work with it? How do we live within it and do things that help the earth to regenerate? Remember, statistics from the WHO are very clear. Only 1% of the population of this world breathes the air that meets the quality threshold of WHO.
Where is that 1%? Because I'd like to live there.
I'm looking for that island. I'm also looking for that. But the reality is, it is so polluted that we have more health challenges from that pollution, air pollution, and toxins that damage our health, health and well-being.
Yeah.
And so when you think about it, you want to try and look at your growth, economic growth, in a climate positive way. Everything you do. This is where we bring in the element of ESG, environment, social, and governance, and sustainability. Everything you do must outlive you in a way in which it doesn't do more damage to the world but brings more benefit and resilience. And that's why we have to question some of these things in our policies, in our practices. Yeah.
Okay. Thank you so much, Justus. We have now come to the end. We want to wish you good luck in everything that you do at Spectrum.
Thank you.
Especially as you continue to ensure that, for you at Spectrum, you are leading on the cross-sectoral projects addressing climate and health. So good luck.
Thank you.
In everything you do. Thank you so much for your time as well with us today.
Thank you for having me, Juliet, and I really enjoyed being here. Yeah.
Thanks for tuning in to Connecting the Dots podcast created by me, Juliet. This episode was brought to life by Mombo and Kevin at Silent Global in Nairobi, Kenya. If you enjoyed this episode, don't just keep it to yourself. Share it, tag us on CTD Pod Africa on all social media platforms. Keep the conversation going. Let us know what you'd love to hear about. And join me on the next episode. This podcast is a product of Silent Global, an African-founded science communication collective.